I'm Mrs. Princey, Associate Professor in Mental Health Nursing. It's very important from a nurse's point of view when it comes to care of patient with mania, right? So, as a nurse, you should be able to identify what are the symptoms of mania. Not only to find out the symptoms, you need to diagnose, do the assessment, and diagnose and plan the interventions accordingly. So, the topic for today is nursing management of patient with manic disorders. When it comes to nursing management, it includes the steps of nursing process, that is the nursing assessment, nursing diagnosis, setting the goal, planning the intervention implementation, as well as the evaluation, right? When it comes to nursing assessment, we have got the assessment of the symptoms. So we'll be doing the mental status examination to find out the symptoms of the patient. So based on the symptoms, you're going to find out the severity of the disorder, whether it is a mild kind of a mania or moderate, severe form or very severe form of the mania. Based on the symptoms, you're going to find out the grade of the mania. By doing the assessment, you're going to collect the history or the information from the patient, wherein you're going to determine the cause of mania in the client so that it is going to help you in the planning of intervention. So, very important to know the cause of mania. So, in the assessment part, you are having the subjective data as well as the objective data. The subjective data is what you collect the information from the patient to rule out the cause. How is the history of the patient, how the disorder developed in him, what are the changes in the personality, which will give you an idea. And when it comes to the objective data, you're going to do the assessment of finding out the symptoms by doing the mental status examination. So that is a part of the nursing assessment. Moving on to the nursing diagnosis, we have got a list of nursing diagnoses that you can have for a patient with mania. Number one, risk for injury related to extreme hyperactivity, for violence related to manic excitement. Then we have got imbalanced nutrition, less than body requirement related to refusal food, impaired social interaction related to egocentric behavior. So these are some of the nursing diagnoses that you can state. Now, what is the nursing intervention for hyperactive behavior? So there is a client with a hyperactive behavior, that is mania. So what is the nursing interventions that you can plan? Number one, you must always keep the environmental stimuli to a minimum. Very important, since the patient is very hyperactive, he will be very much sensitive to the environmental stimuli. See to it that the stimuli in the environment is kept minimal. You have to see to it that you assign a single room for the patient with the hyperactive behavior so that you can limit the interaction with the other patients. So you know when there is a client with mania and also there are other clients in the same ward, so other clients should not get disturbed by this manic patient, because manic patient is always overactive, hyperactive, he will keep on talking, because of which the other client should not get disturbed. So see to it that you assign a single room for such kind of a, keep the lighting as well as the noise level, at the minimum or low, because he will get easily excited when he hears some extra, the noise which is very loud, or the lightings also which will stimulate him, right? So there were cases wherein, even if you had some games planned to the client, okay, such kind of a mini client, say for example musical chair. So when it comes to the noise or when it comes to the sound, you have to play such kind of a music which is soothe, which is not kind of very much energetic kind of a music, because the many patients will get, unnecessarily excited and they will start dancing, wherein those kind of a behavior cannot be controlled. Okay, if you try to stop the patient, he becomes very much aggressive or irritable. So see to it that whatever the environmental, stimuli, it can be the lighting or it can be the sound or the noise, it should be minimal so that unnecessary excitement of the patient can be avoided. Also see to it that his room and the environment, okay, should be minimally furnished. So you do not know when the patient becomes very hyperactive, very aggressive or violent. He may, accidentally or unknowingly, he may use these furnitures to harm him or to harm others, okay, when he becomes aggressive. So see to it that the furnishing is minimal. What is required, only that to be kept in the patient room. So this is about keeping the environment safe. Also, see to it that you remove the hazardous object and substances from the patient's reach. Okay, see to it any kind of the object, it can be related to the glass item, sharp objects, or ropes, or anything which the patient can harm himself as well as the others. Right? Such kind of the object should not be placed near to the patient, or it should not be near to the access of the patient. To keep the hyperactive behavior minimal, see to it that you assess the patient or constructively you involve the patient in some kind of the activities. It can be related to the physical exercises or some kind of the games, or writing or drawing. Such kind of activity can be given to the client so that he can channelize his energy in a constructive way, right? As you know, many clients will have a lot of energy within them, a lot of enthusiasm, so that they can constructively use this energy in the form of exercise or in the form of writing some poems, or writing some stories, or drawing, painting, such kind of activities wherein he may not get excited. That can be given to the client for when he is having the hyperactive behavior. Next thing is, as a nurse, you shouldn't get anxious. You shouldn't become very much anxious when you see such kind of hyperactive behavior. See to it that you stay with the patient as his hyperactivity increases. And another important responsibility is you administer the medication as per the prescription, right? So there are some medications when the patient becomes very much hyperactive or aggressive. To calm down the patients, we may have to administer the sedatives. So under the prescription order, okay, you are required to administer the medication. So these are some of the interventions for a hyperactive behavior. Moving on to the interventions for violent behavior. What are the interventions that you can plan? Number one, never see the potentially violent patient alone. Okay, whenever you go, when you know that there is a patient who is violent, okay, don't ever go alone, right? So always have the other health team members with you. So it is to make sure that you have a safety, or it is also to make sure the patient will become aware that you are not alone to be attacked. There is a group who is there, so the patients will calm down or try to control their violent behavior, right? So that is the foremost important thing to protect yourself as a nurse. Always keep a comfortable distance from such kind of a patient, because you do not know when he will attack you, right? Always a distance, preferably a arm's distance, that you keep with the patient when he is violent. Always be prepared to move. You do not know when he will strike you. So always your senses should be very much active to analyze the situation, and also you have to be ready to move when the violence attacks you. Make sure you maintain a clear exit route, not only for yourself but also to the other patients. Okay, you do not know when such violent patient will start attacking, right? He may attack you or he may attack the other clients. So always make sure that you have an exit route ready. Be sure the patient is not having any kind of a weapon within him before you approach to the patient. You do not know what kind of a weapon he may have. He can have a sharp equipment, or he can have a gun, or anytime he can have any kind of an equipment or weapon within him without your knowledge. So make sure that you see to it that you patient is not having any weapon before you approach. In case you discover that the patient is having a weapon, make sure you instruct the client to keep the weapon down instead of you fighting with him to take out the weapon. It is better to verbalize him, strictly to keep the weapon down before you approach him. So you may not know, there may be very different cases when there is a patient with the hyperactive or violent kind of a behavior. He can strike you anytime. He can have any weapon in his custody. So always be careful to keep something like a pillow or cushion, or something like a blanket which is wrapped around your arm, which is going to protect you from the particular weapon, right? So be cautious about yourself to keep yourself safe. Always you can follow this to distract the patient momentarily remove the particular weapon from him. Okay, you can use any kind of a method to distract the patient. You can suddenly shout onto the patient, or you can just use any kind of a destructive method so that the patient will drop the weapon down. Next thing is you can prescribe the medication as per the order. Okay, so these are some interventions for a violent patient, where it's very, very important to protect yourself, the other patient, as well as the client. Right? So, moving on to the next intervention for imbalanced nutrition. You know very well, in case of the manic patient, the appetite will be poor. There is an imbalanced nutrition because of inadequate intake of food. Now, why is that? Is because he's having the distractible behavior, or he's not able to concentrate on one particular act. He's overactive, right? So whatever activity he does, it will be incomplete. So even in case of nutrition, because of which he will have an imbalanced nutrition, poor hydration, that is, he will have the dehydration, or he may have the weight loss, right? So what are certain interventions to promote the nutrition pattern of the client? Provide high protein, high nutritious, high calorie finger foods and drinks that can be consumed on the run. Right? So since the patient is very much hyperactive, he keeps on moving from one place to another, you can opt for finger foods. It can be, anything, vegetables, raw vegetables like carrot, cucumber, which he can just hold it in his hand, or nutrition bars that he can have on the run. Wherever he goes, he can carry it in his hand and just take a munch of it, right? So which is going to contribute for a good health, for nutrition for the client. Even the drinks or fluids, keep it available in the nurse's station. Whenever he passes the nurse's station, you can just ask him, come down and have a drink. It can be the fluids, water, or juices, anything which is going to give a hydration to the client. Make sure that when you plan the diet, the likes and dislikes of the patient are considered, and also, as much as possible, try to provide the favorite food for the client. Provide 6 to 8 glasses of fluids for the patient. It can be in the form of water or juices, which should be available in the nurse station or in the particular unit the whole day. Maintain accurate record, that is an intake output chart that you can maintain to also monitor the weight of the patient at regular intervals. You can also supplement the diet with the vitamins as well as the minerals, because the patient is having a poor nutritional intake. You can add on the supplements related to the vitamins and minerals. Always be with the patient whenever he walks, okay, at the time of food. You see to it that you be with the patient, walk or sit with the patient whenever he eats his food, right? So these are some nursing interventions that you can have for a manic patient. Hope you all have understood the topic. Thank you.